The current COVID-19 pandemic has put all the people under risk and has severely strained the public health departments of all the countries. Case investigation and contact tracing is a core disease control method deployed by all public health departments. TraceIt application will help to trace patients with COVID-19 symptoms, advise quarantine, identify community spread and keep public health care department notified, integrate with hospitals, testing labs, and provide dashboards and reports for all users of the application.
TraceIt application helps in contact tracing for public healthcare department. Login as Testing Lab user. Dashboard is customized for different operators. Testing Lab user can see the report of total number of patients tested over a period of time. Let's create a new TraceIt case and provide the data for Arjun. Arjun's data is captured along with his existing medical conditions. Upon submission, the data collected is sent to testing lab and hence the status pending test results. On click of Get Next button, the next assignment is fetched. Testing lab user can update the result and submit for further action. Now the case is routed to clinical case worker queue with the status pending clinical case. Now let's log in as a clinical case worker, who will trace Arjun's contacts. The dashboard contains a report of number of cases versus total primary contacts identified for all the patients. Get Next work will fetch the appropriate case for the clinical case worker to work on. Here, we have the case of Arjun. Clinical case worker will collect details of people who might have been in contact with Arjun. Upon submission, the contacts added will be identified with a new case. Created cases will be routed to a normal case worker queue with the status pending normal case as notified to the operator. Clinical case worker will also flag if there is any suspicious community spread with details of the location. This data will be sent to Public Health Department by routing the case to PWD work queue. Now logging in as PWD worker who will analyze the community spread and identify contacts for testing. The dashboard contains the testing data of the patients over a period of time. Get Next work will fetch the appropriate case to work on. PWD worker will capture the details of community contacts. Each contact will be identified as a new community contact and cases are created appropriately upon submission. Created cases will be routed to a normal case worker with the status pending normal case. This resolves the current case of Arjun. The resolved case contains all the data captured during the case life cycle. The phone numbers provided for primary and community contacts can be used to make soft phone call via Skype. It also contains a link to open the individual cases. Finally, let's log in as normal case worker who will capture the symptoms of primary and community contacts and then routes the case appropriately. The dashboard contains the report of symptomatic contacts over a period of time. Get Next work will fetch the appropriate case to work on. Questionnaire will capture the symptoms which helps the case worker to route the case to testing lab. From there, it will follow the case life cycle as demonstrated so far. This concludes the demo for TraceIt. Thanks for watching.